Kwa majina ninaitwa Elizabeth Kiptoo. Mimi ni mkurugenzi wa afya ya umma, director ya public health katika kaunti ya Nakuru. Na siku ya leo nataka kupeana ripoti kuhusu situation ya Mpox, where as a county we have reported a total of 4 cases, and currently we have 1 case who is in isolation. We have managed to trace 42 contacts. 37 have since completed their quarantine period successfully, and they have been discharged. So we have a total of 7 contacts that are under follow-up. As a county, we know we have the largest number of Mpox cases in the country. Out of the 18 cases that we have in Kenya, 4 are from Kenya. And we have identified 10 high-risk areas. And these areas are along the northern transport corridor, all the way from Kamara to Maimahiu, where we have 9 stopovers for the truck drivers. So this disease was imported from Rwanda. And our first case is a truck driver who had traveled to Rwanda and came to Kenya through Uganda. So the first case was reported on that the 1st August 2024. And this county is at high risk. The hotspots stretch to a distance of 162 kilometers, as I said, all the way from Total Junction in Kuresoi North to Maimahiu in Naivasha. So we have developed a response plan. We are working together with our stakeholders to ensure that we put intervention measures in place that will help us to prevent the spread of this disease. This specific time, we are appealing to the members of the public in Nakuru County, because the mode of transmission is through contact, that is skin to skin. It is also transmitted by coming into contact with linen or clothes that have been contaminated. And it is also transmitted through sexually. And so we are appealing to the members of the public to ensure that they put infection prevention measures in place by ensuring that they practice hand hygiene, regularly washing hands with soap and water, or the use of sanitizers, that they should avoid contacts with anybody they are suspecting that they could be having Mpox. And whenever they visit our healthcare facilities, they should ensure that they have their masks on. So we are also appealing to the members of the public that they be on the lookout, so that anybody that exhibit the symptoms that are likely to be Mpox, then they should report immediately. And these symptoms include a rash, a fever or hotness of the body, the swollen lymph nodes, and at times headache and weakness. So they need to report to us immediately through our Public Health Emergency Operations Center or to the nearest health facility. So for Nakuru County, we have prepared isolation centers, both in public, private, and faith-based facilities, with a bed capacity of 192. And we also have other smaller facilities that have prepared rooms where they will be able to hold patients before we send an ambulance to evacuate them to the isolation centers. So we have sensitized our healthcare workers on how to identify these cases, on case management, on measures of infection prevention control, and how to detect and identify suspected cases when they come to our facilities. We have also enhanced surveillance from the community level, where we have community health promoters monitoring the households that they are taking care of, and reporting any suspected case that they come across at the community, so that we're able to intervene appropriately and be able to interrupt transmission. So among the measures that we've put in place as a county is that we have trained our healthcare workers, both in the healthcare facilities and the community health promoters, so that they are able to manage the cases, so that they are able to identify cases, and so that they are also able to protect themselves from contracting the disease. We have also heightened surveillance, and our surveillance system is very sensitive. At the community level, the community health promoters are able to detect cases at the community, report to us, and then when they report to us, we do investigation, and those that meet the criteria, we evacuate them to the isolation centers, collect samples, and send them for confirmation. So our surveillance system is sensitive enough, and that is why we are able to capture all the cases that occur in this county. Yeah, as the festive season approaches, we are worried as a county, and we are encouraging the members of the public to be very cautious so that they don't contract the disease. So we are encouraging that you practice infection prevention measures, ensuring that you don't come into contact with the people that you're suspecting that they could be having Mpox. We're also encouraging the members of the public to always perform hand hygiene by washing their hands with soap and water, or use of sanitizers. We're also asking them to be on the lookout so that they report to us any suspected cases that they have. We have mapped the 10 hotspots that are along the northern transport corridor, where we have stopovers for the truck drivers. We know these cases are occurring in the neighboring countries, and as the population they move. At times they get exposed and they move with the disease. So it is not basically the truck drivers alone, but even people that visit other those countries that are reporting cases. So we have we have plans to sensitize the truck drivers so that they also report to us when they get sick. They report to us immediately. Like our first case of Mpox was actually a truck driver who called us. That driver called us through the Public Health Emergency Operations Center that he was suspecting that he had COVID and he was unable to proceed with the journey. So we had to pick him from Kikope area and brought him to isolation center. So we are sensitizing them through the associations and through the stakeholders that we are working with to ensure that they are able to report immediately. We also sensitizing the patrons to the lodgings along the highway, because one of the modes of transmission is through linen. So we have sensitized the patrons, and we are continuing to sensitize them so that the handlers of this linen take the necessary precautions to ensure that they don't infect themselves. At the same time, they ensure that they disinfect the linen every time they are doing the cleaning, and change them so that we don't have people using the same linen, because it's a risk for transmission.
I'm Waniki Solomon. I'm the project manager working for AMREF, and we are implementing a primary healthcare program. And today we have sensitized the media caucus on Mpox. And as AMREF, we are supporting the county government of Nakuru to implement the already developed Mpox response plan. And as we address the response, we are specifically supporting the capacity building, training the frontline health workers, and of course, as part of health system strengthening, we are training the trainer of trainees so that they can be able to supporting us cascade the trainings to the lower levels, or in the sub counties and the community units. And at the same time, we are supporting training of the community health promoters, who are the drivers of primary health care, as primary health care is the approach the county government or government of Kenya is using to reaching out to the communities at the grassroots. So additionally, we are supporting the county government of Nakuru to reaching out to the key population in the 10 mapped hotspots areas so that they can be sensitized and be aware of how to prevent Mpox and other infectious diseases. At the same time, we are also supporting the county government to reaching out or sensitizing the local leaders so that they can be our ambassadors at the community level, and they are, because they are community resource persons at the community level who are able to disseminate or support us to reaching out to the community and getting this sensitization of Mpox enhanced at the community level. We have continued to integrate the emerging issues, including Mpox and Magak alerts, as we implement the primary healthcare program that is being implemented in this county, which is a 3-year program. And we have integrated these emerging issues into the primary healthcare using the ministry guided primary healthcare networks that we are layering on to deliver the essential health services through multidisciplinary outreaches, through community engagements, through dialogue days, and we are able to again layer on this to deliver key messages of all these emerging issues, including Mpox.